Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Contentment associated with swimming in the ocean. And they also talked about the made it comparable to going in the forest and getting peace and contentment from being among nature. And they talked about some of the benefits of ocean swimming against the limitations of ocean swimming. But I thought it was an interesting way of meditating, which is not too different. To me, it's another form of meditation. Uh, Another article was about arthritis, and since we are all of the age of arthritis, it talks about the uh, most beneficial way of dealing with arthritis of the knees is by wearing a knee brace. But many people don't want to wear knee braces. And they said after knee braces, actually water exercises are the next best thing. Um, and then the next thing that piqued my interest was actually a article about the fact that 49% of young people are addicted to the screen. That 49% are actually addicted, and as we mentioned last week, that addiction increases the likelihood of depression and suicide. And so those are just some of the interesting things that I saw in the Washington Post, which is now having its health section on Mondays rather than Tuesdays. Any comment about any of those things?
Well, I have a
Yes.
comment, especially about the first one, swimming in the ocean.
Yeah, okay.
Yeah, it's a whole nother world down there. I mean, I was fascinated with the ocean my whole life, but I was afraid to get in there. Once I got over the idea that I could breathe underwater, it opened up a whole nother world. So, um, if you ever get a chance to try it, I recommend it to everybody because it is extremely peaceful. Nobody's yelling and screaming down there. Um, it's very quiet. Um, even a lot of people, when I say I'm a scuba diver, I say, are you finding any gold doubloons? You see treasure down there? No, that's not what it's about. Most of the wrecks that had valuables on it are way below the area where I could swim down there to it or dive to it. And the ones that are within the range are they've already been discovered. So no, but it's again, and even the sharks, they usually don't care about us. People are afraid of sharks, right? I've been pretty close to sharks as well, and most of them uh, are actually, looking for uh, surfers on the surface. They really don't mess with the divers that are deeper down. So, and then like we mentioned last week, water aerobics is really great for arthritis, bursitis, all of those aches and pains that we get, that I get. Uh, being in the water and exercising in the water really helps. So that's enough out of me. Thanks for those articles.
Yeah, Janice?
Yes, you mentioned arthritis. Is arthritis related at all to gout?
No, gout is a form of arthritis. That's a different, special form of arthritis. that is related to elevated uric acid levels, and there's a specific treatment for gout. But no, osteoarthritis is related to the trauma associated with increased weight gain or jumping up and down and those kinds of things in which your cartilage is damaged. Cartilage is not capable of repairing itself, so if you damage the cartilage, arthritis is a likely consequence.
So once you get gout, do you have it, or is it just
That's
manageable?
treatable. Well, it's treatable by medication
Yes.
that
The reason,
lowers the uric acid level.
yeah, the reason why I asked my sister just this week was diagnosed with gout. Of course, now she's getting depressed. She needs knee replacement. Nobody's cutting on me again. So she found a doctor to give her a cortisone shot. So she gets that every 6 months. He told her she can get it every 4. She's trying not to. She got the shot a month ago. The pain was worse after this last shot. Then she became lactose intolerant. So she's got all this stuff going on with her stomach. Don't eat this, don't eat that. Then this week, it's gout. Um, does gout have anything to do with that lactose intolerance? Or,
No,
okay.
no.
I guess she just having bad luck. I don't know. But they did give her medication for the gout.
Yeah,
And she said she just took 2 days worth of the medication and it's much, much better.
yeah.
But she needs to find out what brought it on. She thinks it was seafood.
Oh, well, yeah. Well, food will bring it on, yeah,
Yeah.
because whatever elevates your uric acid level will cause
Mhm.
you to have gout.
Okay. Thank you.
Okay. Any other comment about the articles? If not, we can move on to our first articles. We have, one of the things that we have to address is that we usually cover maybe about 20 articles a session, which leaves about 4 or 5 articles that we don't have a chance to discuss. So at some point, we should probably go over those articles that we haven't discussed that you folks think are important that we've missed. So keep that in mind. And if you see some of the subjects that we've covered that we've not had a chance to discuss, why don't you just send those to us so we can have a session where we just discuss the articles that we haven't discussed that we could have. Okay, this is an interesting article, although its relevance to us is is questionable because they find new blood types apparently every year, but usually, for example, this blood type is only one person on Earth has it, so it's only important to her or him, uh, and the ABO and the Rh positive and negatives are the commonest blood types, and so but there are other rare blood types that exist but aren't particularly relevant to anybody except, for example, this lady is therefore would have antibodies to everybody else. So she's probably the only person who she could receive a transfusion from. So a lot of those other blood group types are of interest only to the researchers. Don't really have much applicability to us because most of us have the conventional ABO types and subtypes. So that's the long and short of that particular article. Any comments about it? Uh, this next article is very timely in the sense that we're now concerning ourselves with measles because of the fact that there are people out there who are unvaccinated and measles now is recirculating. Fortunately, it's just slowing uh, and as you can see here that there are 3 deaths. Uh, but as you know, the disease has really been eliminated across the globe. And so this new uh, breakout of measles is something that is frightening, particularly if you're not vaccinated. And so that's why this, for some, consider this a new epidemic. And since measles is considered to be probably one of the most contagious viruses of all, it becomes important to uh, be sure that you're vaccinated against measles. And MMR is measles, mumps, uh, uh, vaccine is one of the commonest that most of us have had to receive in order to go to school. But then there are those who who don't get vaccinated for medical reasons. Okay, any comment on that? If not, we'll go to the next article. This is a article about why although 17 members of the CDC advisory committee were fired. And it's an interesting article, but I don't know if it's going to do much good because they were already fired and it's unlikely they would be rehired. But anyway, Bernie Sanders felt that uh, it was inappropriate and it should be investigated. I doubt seriously if they're going to investigate it, but anyway, it'll be interesting to see, and if they did, what would be the consequences? Anyway, and then he's done things independently that have had nothing to do with any committee, and that to me is something they might address. But the changing of the guard in terms of the advisory committee, it's going to be interesting to see if anybody pays attention to that. We shall see. Any comments about RFK and his behavior? Not very dissimilar to his boss Trump. So he's doing what you would expect him to do under his leader. This is a former Democrat who is now a Republican.
Being terrible. That's my comment. He's just a terrible.
Well, he's there for 4 years. 4 years. Yeah. Okay. Well, let's go to the next article. Uh, and It's an article about gastrointestinal problems, and they talk about 5 of the most common conditions as they're becoming more and more common. There's none of them that would surprise you, but anyway, you can go down to the list of the 5 common. Abdominal pain, of course, is something probably the commonest of GI symptoms, and whenever you have pain, it's a good idea to get your doctor to check it out because sometimes that abdominal pain may require surgery. More often than not, it may be related to other gastrointestinal problems that are treated by medical means. But when you have pain that persists, it's important to have the doctor evaluate it and see what's going on. Nausea and vomiting is something that is second most common cause of emergency visits, and there are many conditions that are responsible for that, and they need to be researched and to figure out what medication or other item that you took in is more likely to be the cause of the nausea and vomiting. Then, of course, the diarrhea and cramps and gastroenteritis is the third most, and sometimes it's related to infection and sometimes it's not. Darryl?
Well, since processed foods contribute to gastrointestinal problems, I would think that's the likely suspect.
Well, thank you. And then, of course, constipation. Uh, they are alleging that it's related to not drinking enough water. It's more likely to be related to not consuming enough dietary fiber. And then, of course, if you don't exercise, that's an additional problem. Then with GI bleeding, whenever you have bleeding, if it's from the upper GI tract, it's going to be black bowel movement. If it's from the lower GI tract, then you'll have red blood. And anytime you have bleeding, that means you need to go see your doctor and find out why you're bleeding, because bleeding needs to be controlled. Otherwise, it becomes lethal. So those are the common issues. They don't talk much about the fact that lactose intolerance and dairy products is also another cause of GI discomfort. Any other comments on this article and we talked before about looking at your bowel movements because it can be an indication of what's going on with your gastrointestinal tract, whether your stools are brown or white or black or bloody. All of these things are important. So it's a good idea to look at your bowel movement when you have it to ensure that things are what they ought to be. Okay, let's go to the next article if there no comment. Now, this is an article that is not surprising. We've had a number of articles recently talking about the consequences of drinking artificially sweetened beverages to avoid diabetes, when in point of fact, the more recent studies are suggesting that these sweeteners actually may be related to causing type 2 diabetes. So it's particularly those with saccharin. Uh, so the more we know, the more we know. And sometimes what we think are cure for one disease are the cause of another. And so more and more studies are pointing to the fact that saccharin, which replaces the sugar for the diabetic, can also, over time, result in diabetes itself. Okay, so any comments? If not, this is important to be aware of as you try to avoid sugar. Darryl?
Yeah, the saccharin brand names are Sweet and Low, Sweet Twin, and Nectar Sweet.
Okay. Thank you for sharing. Uh, this article talks about foods that are lower the risk of cognitive decline, and no surprises here. We talked about foods rich in vitamins, magnesium, zinc, and selenium, and nuts, greens, berries, and whole grains and plant-based foods are great sources of the antioxidants, which are associated with decreased likelihood of dementia. Here again, article after article is emphasizing the importance of a plant-based diet relative to a meat-based diet. And here again, it seems to be study after study demonstrating the value of getting away from meat-based diets. Now, this article also talks about the negative effects of alcohol and that the protective effects of antioxidants are done away with by alcohol. So, in addition to alcohol causing cancer and many other things, it is problematic for many reasons. This is a list of the uh, dietary factors that are associated with uh, protection against deterioration of your brain. And so look at this list, and uh, sweet potatoes is an interesting addition, carrots as well. Uh, any comments on interesting article that I think is, and I like this comment, instead of reaching for wine, gets you some fruit salad or nuts and leave the alcohol alone. So this article also talks about trying to use your plant-based smoothies as something you drink rather than other things because it has so many antioxidants in there. Good tidbits there. This is an article that goes the other extreme. They are looking for products in Texas, and they label them as not recommended for human consumption. And this is a Texas food, and it targets M&Ms, Doritos, and Mountain Dew. It's products that have dyes and other things that are associated with the increased incidences of diseases, most notably cancer. As you recall, the red number 3 and yellow number 5. That's for Texas. I don't know any other states that are doing that, but the goal is, of course, to minimize the amount of ultra-processed foods in your diet. And it's interesting because most of the frozen foods fit into that category. So those people who are older and are unable to cook for themselves and they get frozen foods, they have a large amount of ultra-processed foods. Any comments? If not, Darryl?
Yeah, internet says that currently Texas is the only state labeling foods as unfit for human consumption.
Yeah, so the only state. Yeah, it's interesting. Will other states follow? That's a good. Be interesting to see what happens. Yeah. Let's go to the next article then. Oh, this is a interesting article because Medicare Advantage plans. There's Medicare plans, and then there's Medicare Advantage plans, and this article alleges that most of the Medicare Advantage plans don't accomplish their goal. That if you stick with the A, B, and D and forget them, you're just as well off. I don't know. I'm not experienced with that because I haven't gotten to the point where I have used Medicare yet because I'm still working. So when you're fully employed, you have Medicare, but you don't use it. Use your primary insurance. There are those out there, however, who have Medicare and they use Medicare Advantage plans. So you may uh, see what this article is talking about because they point out that most of the Medicare Advantage plans take advantage of you rather than actual helping you. Carol Tatum.
Yes, I was going to do that once, change over to Medicare Advantage. I found out I would have to pay more out of pocket than I would if I stayed. I had signed up and then I quickly, within 1 week or two, withdrew. They really didn't want that. But like they said, that plan is ridiculous, but they call you all the time and they are pushing people to get to Medicare Advantage, which is to leave your regular system and then basically, you're just going to pay more out of care pocket money than if you would if you had stayed with your own plan. That's my experience with it.
And that's exactly what this article says. Yeah. Yeah. Any other comment? Oh, Joyce Springfield Saunders.
Yes, my cousin, before she died, she had Medicare Advantage. And what Carol said is very, very true. We were trying to get her into a nursing facility, and they only wanted her to go to a nursing facility that they recommended. We had no say-so in what facility she would go to, and the cost, everything was dictated by them. Um, well, when open season came, we immediately transferred her from Medicare Advantage back to the regular Medicare policies, and everything was started to work out to her benefit.
Thank you for sharing. Betty Blaylock.
Yes. Um, I my husband and I have Medicare Advantage, but I don't know if there are different types because um our out of pocket is virtually zero. And I don't know whether I know we have Medicare and then, and it includes, of course, A is the Medicare, then B you you pay for, and C is something, and D is
Medication.
dental, I think.
Medication.
Yeah, medication. Okay. Well, we have Aetna, but it's marketed as the Advantage Medicare Aetna Advantage plan. But I mean, we go to all our doctors, we pay nothing for out of pocket. So I'm assuming that there are different types because ours has helped us as far as out of pocket.
Oh, thank you for sharing. Dr. Perez.
I agree that uh, it can change significantly depending on where you are and what doctors you have. You can have an advantage plan. That means you only can take physicians, facilities, studies that are part of that plan. Once you go outside of that, then it is all out of pocket. So they have a greater control about who you see. Advantage plans often also offer you vision and hearing. But again, that's all within where you're receiving your care. So if all of your doctors are part of their plan and they're all near you in terms of geographic location, then you usually don't have a problem with the Advantage plan. Once you move out or you have something that requires a specialist that's not part of the plan, you run into problems. So it's a more, it's greater control over what services you receive from the Advantage plan. And now, once you have an Advantage plan, it's difficult to go back to just plain Medicare.
Thank you for sharing. John Buchanan.
I had a very similar experience as Betty. Um, I have Kaiser, and when I switched to the Advantage plan from Kaiser, um, I have zero copays. Also got my hearing aid, $6,000 hearing aid for free. I mean, I have to really applaud that part. My only complaint though, and it's not really a complaint, but they kind of haggle me about my medications. So they send me all my meds in the mail for free, and they send me an email. You have 2 prescriptions ready to be filled, and uh, I might have just had it filled. So they kind of push you to keep you up to date on your medication. But that's the only complaint I have. They kind of bombard me with reminders to refill my meds. That's it. Thanks.
Okay. Pearl Lipscomb?
Yes, I too have Kaiser, but I by being retired from the postal service is changing, is switching over from original Medicare to um well, they're switching their health plan over from original Medicare to the Medicare Advantage thing, and they were in the processes of doing it last year. But I find out that having the original Medicare, it was much less complicated than having the Medicare Advantage. But just like John said, um, they do send you something. In fact, I think I probably get something from Kaiser or Medicare or whatever almost every week. I have a stack of information, I guess, that I've gotten from them. You need to fill your prescription. Did you check with it's time for this appointment? It's time for that appointment. So it's like I say, it's much more complicated than with the Advantage than it was when it was just the original Medicare. Now, as for the expenses, I so far I haven't had to pay anything for anything, so I'll just see what happens as it goes along.
Okay, thank you for sharing. Any other comments, pro or con?
Yes. Um, my Dr. Perez mentioned going out of your network, and that is true that whatever plan you're in, they do have their own network. But recently, I had to go to see a doctor about my breasts, and the doctor that was in the network was further away from me, and I wanted someone that was close to me. And so I just went on and made an appointment, and I said, I'll just do whatever, you know. But when I went there and I showed them my plan, they didn't charge me a thing either. So I don't know whether it's just like my sister said, I too have that new postal plan. I don't know whether it's different, but they accepted my insurance and they didn't charge me a copay or anything when I went out of network.
Any other comments? Thank you for sharing. Okay, let's go to the next article then. This is just a preference of a blood ketone test, which is much more sensitive. Gestational diabetes is diabetes that you get when you get pregnant. And this is a condition that is increasing. And following it by urine levels was how it was done before. And in Italy, they have identified that doing blood levels is more accurate way of following gestational diabetes. Of course, none of us in this group are likely to have pregnancies or gestational diabetes. So this is for your children and grandchildren, I guess. To know that based upon this study that was done in Italy, that the blood ketone levels are more reliable than the urine ketone level for making this diagnosis of gestational diabetes. If there are no comments, let's go to the next article. This is an article that kind of puts into perspective the intaking of protein being the most important thing to deal with. And as we know that proteins are found in with meat eaters as well as in plant uh, eaters. And so it really, uh, those people who try to use protein as a reason for doing one or the other really don't have any leg to stand on because, as we know, plant-based diets as well as meat-based diets can be rich in protein. And so that's not a differential point. But the point is that it's the protein base that is really important. And when you look and you compare the plant-based diet and the meat-based diets, the healthier diet is the diet that is associated with the plant-based diet. And we talk about carbohydrates and fats and proteins. And of those, the protein aspect is that which allows you to build muscles. But in building muscles, exercise becomes very important. And so that uh, uh, having that protein and not exercising doesn't give you the best of all worlds. But when you have the protein intake being adequate and exercise being adequate, the two together really promote a healthier lifestyle. And of course, uh, the plant-based diet does seem to make a difference. But the combination of diet and exercise is something that is invaluable. One of the studies that, they used to talk about the firmness of your hand grip. Now we're talking about the ability of you to sit and stand without using using other support mechanism, and saying that the best life extender test is one in which shows that if you can sit up without benefit of support, that this is probably one of the best tests that you can have of your ability to survive. And you see a lot of this really depends upon your muscle strength. And of course, this can all be improved by exercise and lifting weights as well as other exercises. Any comments about this important article that discussed the importance? Betty Blaylock?
Yes. My husband and I go at it all the time about using the arms on a chair to get up. He probably can't get up out of a chair without using the arms, where I pop up in a second without using the arms. And so he's asked if that is what you're talking about.
Yes, that is what I'm talking about.
That's what I thought.
Yes.
Yeah. Thank you.
Yeah. Yeah. Any other comments?
Papa.
I have a comment. This is John Tatum. Safety is a concern in the situation that Betty Blaylock is talking about. Betty, if you are able to get up without holding on the arms, chair arms, that's good. And if you're safe, that's good. On the other hand, Charles, if he cannot get up without using the armchairs, by all means, use them because it's safer. You got to think of safety as well.
Thank you.
Don't want any
While
fall.
while it is safer, I think one of the things that people are looking for are ways to identify uh, what correlates with longevity and what doesn't. And they're just saying that the ability, the hand grip strength and the ability to sit up without relying upon support is a better measure of your ability to survive and surmount cardiovascular situations. So it's not a matter. I would agree with you that safety is important because what we know is that the biggest problem we have as we age is safety. We have so many deaths from falling, particularly as we get over the age of 65. So yes, as you said, it's important to do the safest thing because when you're over 65, the number one cause of death is falls. So yes, you should be safe. But I guess this article is just saying that the ability to get out of a chair without support suggests that you are stronger than somebody has to rely on support, like most people who are over 65.
Thank you.
Dr. Callender, I just wanted it reinforced because my husband will not do strength exercises to help strengthen his arms. And I know he does have arthritis and all of that, but still you can move to some degree where it may take a while, but you can eventually strengthen enough to at least stand.
That's what many of the articles are suggesting, that you use this as a wake-up call so that if you can get to the point where you can do it without support, then you're better off than the other situation. So that's the goal. So it's not easy though, and most people aren't as strong as Betty Blaylock is, and but it's something to shoot for. John Tatum.
Yes, the other issue is that this is a type of exercise as well, because we use it at my physical therapy, getting up from a chair with arms, but you have to do like they have to find out how many you can do in 30 seconds. And so it becomes an exercise so that one day, you continue to do this exercise, and one day you might gain the strength to get up without using them.
Thanks for sharing, John. Okay. No other comments. Let's go to the next article, please. We've talked about the metabolic fatty liver disease, which is what the MASLD now stands for. And what this article is saying now we have a way of treating this. About 5 years ago, we had no way of treating this other than saying lose weight and control your diabetes. Now we say lose weight, control your diabetes, and also we have medications. The GLP-1 drugs are capable of treating MASH or MASLD, and this is a remarkable new change, and as a consequence, the guidelines for treating fatty liver disease is now changed, and we have a way of treating it which we didn't have before, and so we're entering actually a new era, and so it becomes important to make a diagnosis of fatty liver disease or fibrosis of the liver because now we have treatment for it. And that's the importance of this article. Okay, and then we have a new tool of measuring fibrosis, which we didn't have before. Joyce Brimfield Sanders. Joyce, did you have your hand up? Okay. All right.
Yes, I did. Yes, I did. I was diagnosed with the fatty liver disease about 3 years ago. 3 or 4 years ago. And the way they found out that I had it is through my blood test. It showed some raised levels for my blood work that related to my liver. And after a sonogram, it was confirmed. And my doctor recommended that I take a look at my diet, do some exercises, and see if I can control it by food and exercise. And I did. I went on the intermittent fasting diet, and 2 years later, I went back and had another sonogram, and the doctor was very surprised to see that the liver did not show any signs of being having the fatty liver disease. So, yes, it is curable, and I get a sonogram maybe every year, twice a year, every year or every other year, and it still has not come back, and everything is working well with that.
Thanks for sharing. Thank you very much. Next article then. This is an article that talks about the best and the worst foods for your kidneys, and there's no surprises here. The leafy greens and others help lower, and of course, sodas, salty meats make it worse. So there's no surprises here. What we've been talking about is, and there are many instances in which people who had meat-based diets, who had kidney disease, who switched to plant-based diets, had remarkable improvements. And so, and this is identifying the best foods, the dark leafy greens, tart cherries, tofu, flaxseed, garlic. Uh, I thought it was only good for werewolves, but lo and behold, it's good for something else as well. I don't know if you have many of you garlic eaters out there, but anyway. And then the worst foods, sodas, frozen dinners, fast food, ultra processed cheeses, and of course, too much meat. So it's good to have a laundry list again and again, knowing what to do, what's the right thing to do. Darryl Armistead?
Yeah, the secret with eating garlic, if you're married, is that both people have to eat garlic in the same meal, because that way you don't notice the bad breath of the other person because you got it too.
Oh, thank you for sharing, Darryl. That's an interesting way of looking at it, Darryl. Okay.
As a newlywed, the old
Okay.
married people don't care.
Okay. All right, let's go to the next article. It's interesting. This article says managing weight in older adults isn't about weight at all. It's about healthy lifestyles, which is really what is important. Uh, if you have a healthy lifestyle, I think that matters most. Of course, if you have a healthy lifestyle, you're going to lose weight and you're not going to be overweight. But the essence is the emphasis on healthy lifestyle, appropriate diet, and exercise as well. And that's the real bottom line. And this article is suggesting that those people who look at one rather than everything else together are making a big mistake, because it's all about the whole health of the person and the lifestyle that they exercise, they use weight, lift weights, they do all the things that are important. They take the blood pressure medicines as necessary. They and they meditate and do all the things that are an important part of being healthy, because mental health, physical health, spiritual health all go together to make for good health. And one without the other does not give you a healthy lifestyle. John Buchanan?
Yes, Dr. Callender, what do they mean by polypharmacy?
I'm sorry?
Polypharmacy.
That means that you take a whole lot of medications inappropriately. Yeah, and the older you get, the more important it is not to take a whole lot of medications unnecessarily. You take only the medications that are necessary for you to to have good health. But as you age, uh, there's many articles that talk about the fact that particularly people over 65 are on too many medications, and that is what is called polypharmacy. When you take more medication that you need. And so you need to have a gerontologist every now and then to take a look at all the medication you have and take away those that are unnecessary because the biggest problem in aging is the fact that many people are on many more medications than they need to be on.
My primary physician asks me to bring all of my meds and supplements every time I see him. And my previous 4 or 5 physicians did not. But yes, I think that's very important. And he actually knocked down 2 that I've been taking for many years. The glucosamine chondroitin and the fish oil. He said, don't worry about those. Drop those. So yeah, I noticed I have a lot of medications, a lot of them.
Thank you for sharing. Okay. We'll go to the next article now. This is the article that talks about the fact that these new GLP drugs have identified as some vision issues. You can see the non-arteritic anterior ischemic optic neuropathy seems to be more common in patients who are on the GLP-1 drugs. And this then is food for thought as we hastily use the GLP-1 drugs. We have to keep in mind that there are side effects. As we know, there's side effects of all medications. And it looks like this may be an area that we have to be careful of. So as we take these drugs, we need to be sure to get our visits to the ophthalmologist at least once a year. Because it does appear as though there is an increased incidence of ophthalmological problems. And one of the things to be reminded is that most of the GLP-1 drugs are less than 5 years old. So it's going to take time before we really know all of the adverse effects of GLP-1 drugs. We know many of the benefits, but we don't know all of the adverse consequences of these drugs. Time will tell. Yeah. No comments. Let's go to the next article. We just talked about the adverse effects, and one of these that they've tried to identify but seem not to hold up is this association of cancer with GLP-1 drugs. So far, they haven't really done a good job of demonstrating them, but I think we just need to give it time. I think when we get to the point where we've had about 10 years, we should have been able to identify all of the adverse effects of GLP-1 drugs. But most of the ones that they propose, it's tough to really say we have enough data to say that thyroid cancer or pancreatic cancer is associated with drugs. Yeah. Time will tell, but the early evidence is not convincing. So we have to keep our eyes open, as Dr. Perez has often said, this is an opportunity for our institutions to do the groundwork in terms of identifying the adverse influences of these miraculous drugs. Okay, let's go to the next article. This is an article that suggests that one of the problems with dealing with patients who are overweight is that the physicians or the healthcare providers have their own biases, and these biases affect the treatment of people who are overweight. And this study looked into ways of decreasing the biases of the physician. And when they did that, they had evidence that the patients were treated better. And this then is a recognition that physicians have biases as well as other people. And if their bias is that if you're overweight, you're guilty or something, then that reflects the way in which you treat them. And that treatment is not the best. And that's what this article is all about, is that when the biases of the physician was corrected, the patient was treated optimally. Which means that, in other words, they treated the whole patient instead of just the fact that the patient's obese. Dr. Perez.
That was one of the number one recommendations for unequal treatment, confronting racial and ethnic healthcare disparities. Because if not just in how you feel about somebody's weight, but how you feel about somebody's race, somebody, which is a social construct, how you feel about so many biases has an impact, and how important the physician-patient relationship is. So, I mean, here we're looking at weight as an indicator, but there's so many other aspects, and utilizing this study to impact how physicians treat people and why it's important to investigate it is very, very important.
Thank you for sharing. Okay. Any other comments? If not, we'll go to the next article, please. This is something that we have tended not to pay too much attention to. The fact that creatine, which is a breakdown product of muscle metabolism, actually figures into weight loss and muscle quality. And that creatine is one of the most important studied supplements in the market. I really wasn't aware of that until I read this article. And that actually supplying creatine actually is a therapeutic tool for fat reduction. And it shows that it works by increasing the stores, which boost energy during exercise. And so for that reason, creatine is a supplement which can be helpful in the makeup of musculature, and particularly in those patients who take GLP-1s. As you know, sarcopenia, or reduction in muscle mass, is a side effect of that. And so the combination of GLP-1s and creatine may well be very helpful for those patients who are on GLP-1s and whose muscles are sarcopenia, or the muscles are deteriorating. So it's food for thought. Creatine is a supplement that might be helpful with GLP-1 drugs, in which sarcopenia is a consequence. And since the GLP-1 drugs have effect on so many different organs, it does appear as down the road, it may be a combination creatine plus GLP-1 drugs that may be helpful in the long run. Any comments on this, Darryl?
Yeah, a lot of bodybuilders take creatine. It helps build muscle, but when you take it, it's really important to drink a lot of water because that'll draw the water into the muscles where it's important.
Thanks for sharing, Darryl. Thank you. Okay. How much is your weight you're lifting?
Just a 15-pound weight.
15 pounds. Wow.
Mhm.
I'm still doing 10 pounds. Okay. All right. Let's go to the next article. Now, this is a drug that is a GLP-1 drug that is associated with elimination of cardiovascular risk factors. And this is a drug that controls the blood sugar, the lipid profiles, and insulin resistance. So it's a kind of a drug, tirzepatide, a GLP-1 drug that may be one of the most beneficial GLP-1 drugs of all. And this is a study that points out the fact that its effect on the cardiovascular system may be one of the most important aspects of this particular GLP-1 drug. To keep in mind that its effect on the blood pressure, the weight circumference has been remarkable. But anyway, as we said, time will tell in terms of the long-term consequences of this drug, which they appear to be wonder drugs and may well be, but long-term studies will give us a better idea. Okay. Go to the next article. That's fine. This is an interesting article that says that when it comes to weight loss, that most of the weight loss that you lose is gone within a year after you um, stop doing whatever you did to lose weight. However, they say if you combine this with peer support, that you may continue that weight loss. And this then is another strategy, is to do it along with somebody else, with a mentor. Many people have the individualistic style and haven't paired with others. And they're suggesting that this is a better mechanism of long-term weight support. Dal, have you managed your weight loss? Is that have you had a peer, or is yours just individualistic?
No, just pure D stubbornness.
Okay, all right. That's good to hear. Pure D stubbornness. Okay, well, let's share a lot of that around in this area to help us adopt healthy lifestyles. And then if you have a partner who can do it with you, that's even better, I guess. But it's that's what this study suggests. But being anachronistic and being an individual and being stubborn and committed to keeping your weight off becomes another way of doing it. There's more than one way to skin a cat. Yes, Darryl?
Well, okay, there's an old saying that says knowledge is power, and that's really true. Um, the more that you explore and study nutrition and its effects on your health, then the more you become committed to it. because like when you know better, you do better, and there's a lot of recidivism that you can't do. You can't backslide once you really know that something is going to have an unlikely consequence for you.
Thank you for sharing, Darryl. You've helped many of us to adopt healthier lifestyles. Let's go to the next article then.
And on that point, even though it's not stressed by that article, the issue of some of, I know I always hear you in my head about processed foods. And now process, I don't know, considered processed protein drinks, colostrum and cassava and different things like that. Are they considered processed? And should we be looking more for smoothies that we make with whole foods?
Darryl, you have any thoughts on that one?
Yeah. Cassava isn't necessarily all that bad, and um, my wife tastes cassava. I just at first, since I didn't know anything about it, and you buy it already made up. My bias was that it was processed and don't do it. But after researching it, cassava wasn't that bad. Um, but yes, you are better off um, making your own fruit and vegetable smoothie is a better alternative than doing something like cassava. So, if you can go with whole fruits and whole grains, that's always going to be better than anything that's already store prepared.
Thank you for sharing. Uh, this is a very interesting article. And when you look at a study that analyzes 12,000 participants older than 50, and you get to the point that you recognize that there's a benefit of having a targeting a blood pressure of 120 rather than 130 or 140, and see the difference that it makes, it does impress you that we as physicians and healthcare providers should be targeting lower blood pressures. And that's what happened in this case. And now the other thing that is emphasized here is that you take the blood pressure under certain conditions. 5 minutes of seated rest, and then they get 3 blood pressures. And then you don't talk to the patient, you just let them sit there. And I think that is something that maybe the healthcare providers aren't really doing, so that you don't really know what is their resting blood pressure. And so I think that's important. And I think the fact that you target for lower blood pressure does make a lot of sense. And it's something that uh, medicine has been emphasizing over the last 5 years. Any comments or uh, opinions about this practice, targeting the lower blood pressure? It made a difference in the diabetics. Dr. Perez.
I just have to bring in unequal treatment again, because there was a time in medicine where we thought Black people could have a higher blood pressure. And ABC proved them to be wrong, ABC being the Association of Black Cardiologists. So they thought, and I think it was a practice as well at George GW, that Black people um, could maintain a higher BUN and creatinine as it related to their kidney health before even being considered for transplantation. So bias racial bias, cultural bias, institutional bias has had an impact on what we look at and whom we look at. So that's why it is so important that we be a part of clinical trials and we appreciate racism in medicine.
Thank you for sharing, Dr. Perez. Let's go to the next article then. We've talked about this already, about saccharin tied to increased diabetes risk. After a 30-year study, I think it's pretty hard not to resist. It's pretty hard to resist the fact that sugar substitutes, while they may be beneficial for those who don't use sugar, also produce more people with diabetes. The evidence is stronger for that. So whether we like it or not, that data is pretty clear. Darryl.
The internet says that Trump drinks 12 cans of Diet Coke each day.
Well, maybe that contributes to his sanity. This is an article about using testosterone gel, and it does not help hip fracture rehabilitation, although we thought for a while it did, but it doesn't. So we have to keep in mind that getting the fracture repaired and being active as soon as you can after the fracture is treated becomes important. Because without the exercise, early exercise and ambulation, hip fractures associated with increased morbidity and mortality. Let's go to the next article, please. This is an article from, I think it's in somewhere outside of the United States, England. That's where it is, in England. And it showed that interpretation of medical scans actually were associated with inappropriate treatments and people dying as a consequence of mistakes, suggesting that more AI needs to be involved along with the physicians reading the x-rays in order to prevent these scan failures. Because the scans didn't fail, the interpretation of the scans was what failed. And so one of the things that can be done actually is this is one area in which AI can be helpful. Artificial intelligence can be helpful in terms of having scans read by physicians and AI and ensuring that mistakes in interpretation are overcome. In the England, these mistakes were identified too late to be helpful. Dr. Perez.
Again, wouldn't you say that AI learns by what it's given? So it again reiterates how important it is that AI be educated about us.
About all.
About all.
Right. I agree. Yeah, and I think that's why where AI is used, the community has to be involved to make sure that there is not the biases that we already bring to the table that we've already discussed sufficiently today, because those biases make a huge difference. And so AI can be as guilty of it as anything else. Yeah. And so we can affect AI by having a balanced perspective put into everything and having all ethnic groups involved in their uses. AI can be a great benefit in medicine. And you can see here it enhances prostate cancer detection, and so much so that some urologists no longer do rectals. They will get a MRI of the prostate and use that to decide whether you have prostate cancer or not. And so when they say use AI, they use AI and they look at them as itself. But together, this makes the diagnosis of prostate cancer difficult to miss. So this is something that urologists are now spending much more time with than, as a matter of fact, some urologists tend not to do rectals anymore to evaluate the prostate. They do MRIs to evaluate the prostate. And this allows them to differentiate between benign prostatic hypertrophy and cancer of the prostate, which of course is a disease that you're going to find BPH or prostate cancer in 90% of men, all men. There are no comments. We'll go to the next article. And this is an article that points out that there's even a bias about AI, and that this doctor, when he used AI, he was comfortable. When he didn't have AI, he felt uncomfortable. And when you have been used to having AI and you don't have AI, it made a difference. And this is something that is going to become more and more part of the practice of medicine. So any other comments over this and the role of AI medicine today and tomorrow? Dr. Perez.
I think they're here, as we've seen in other things. We're talking about AI as if there's equity in its use. We have to assure that there's equity in its use, and that it's available to everybody. And as we can see with what's happening with this big messy bill of the guy who has 40 cans of Coke with saccharin in it every day, that we can be in a very serious state of affairs given what we're doing with this in this climate where we are stepping away from good quality research.
Thank you for sharing, John Buchanan.
Yes, this reminds me of the Star Trek tricorder, where you could just take that little box and just go over someone's forehead and determine everything that's wrong with them and the treatment for it. I think it's coming.
Thank you for sharing. Any other comments? If not, let's go to the next article.
I got a comment.
Yeah, go ahead.
AI is just getting better and better all the time. It's machine learning that is exponentially increasing its effectiveness over time. A year that you may hear more and more as time goes on is the year 2040. That's when it's expected that humans will reach the singularity between technology and mankind. So the singularity is a hypothetical future event where technological growth, particularly in artificial intelligence, becomes so rapid and profound that it fundamentally and irreversibly alters human civilization. So it's coming. It's the it's the wave. It's the train of the future. It's not perfect now, but it'll be more perfect tomorrow than it is today.
Thank you for sharing. Any other perspectives? If not, we'll go to the next article. This is a kind of disturbing article in many ways, although when you look at the data, uh, residents less likely to commit suicide than most other people, but still, it remains the leading cause of death among medical residents, and they talk about the many reasons why. Talk about working long hours and all this stuff. Haven't been brought up in an environment of working long hours and all of those things. The thing that is most bothersome about that is that the dependence of residents on factors, on the fact that they have to do so many administrative tasks rather than work associated with getting patients better is probably the greatest obstacle. And having to do so much more paperwork and less interaction with patients is as problematical as well as also having people going into medicine for the wrong reasons. And the wrong reason would be going to medicine to make money rather than to help people. And so, uh, as we look at all of the data, it does show that the leading cause of death in medical residents is suicide. But even so, the suicide rate is still less than the population. So that the real problem is what's going on in the whole world, not just what's going on in medicine. So it's more than meets the eye. The data gives you a partial study, an idea as to what is really wrong. But I think that's just the tip of the iceberg. And that, yes, improving the work hours may be helpful, and improving life itself may be what the issue is. As I look at some of the issues that the residents face, they face marriage, breakup of marriages, families being discontent because uh, they got married for the wrong reasons, and there are many factors that are involved, few of which are detailed in most of these articles. Uh, Betty Blaylock?
Yes. I was just thinking, you talked, the last article talked about AI helping with diagnosis and things like that. Is it any way possible that AI could probably help with the paperwork so that they wouldn't have to do as much, residents wouldn't?
I don't know the answer to that question because actually, I think it's more of a human problem. And they need to have more people who, social workers and other people who do their tasks appropriately so that the medical doctors don't have to do their work for them. So AI probably wouldn't be as helpful as more human bodies to actually address some of the non-physician issues. Uh, because most of the issues that are problematical are human issues. You know, the fact that we're dealing with homeless people who don't have any place to go to after you take care of their medical ills, and other such things which AI doesn't give you a solution for. That's my take on it. Others would have others, but I think it's the non-physician aspects of it, whatever way we can get them handled, would help a lot, whether it's AI or whatever. But most of the issues I don't think are handled by AI. But it doesn't really matter how it relieves that burden and those obstacles. Uh, Whatever relieves those obstacles is the thing that is important.
Okay. All right.
John Tatum?
Yeah, Betty had the same question that I did. I think certainly AI could help them with something. They might not use it exclusively, talking about the residents, but there should be, and I think there are some tasks that AI could help them with. I know in my field, um, I have a lot of administrative work, and I rely on AI to help complete that administrative work. So I would think that there is something AI could help the residents with.
Yeah, I'm sure there is something, but I think the majority of issues are not AI issues. But I think your point is taken that there are some issues, but the majority of the non-physician work that they do is related to uh, ways in which people need to help other people, and that's really social work. Dr. Perez.
Well, that was pretty much my point. Like you said, it's our society. You know, you do all that you can do. You work hard. You bring a patient back from the brink of death, and you have nowhere to discharge them. You discharge them to the street,
That's
or
right.
you take care of somebody and you send them home to domestic violence, or just so many of the ills, just racism. That I know that this woman needs a hip transplant, but because she's black and you think she's poor, you're not going to make that recommendation. You're not going to call for that consult. And yet you are over me. And if I begin to bring opposition to that, there goes my career. Not only what I sacrificed for, but everybody in my family sacrificed so that I could be here. And now you're faced with it. You're faced with it day after day. I wrote an article about how racism stole a pound of birth weight from my son. Why? Because in order to go see my obstetrician, I had to stand on the other side of the street because I knew a cab would not pick me up if I was going to Harlem.
The realities of life, and uh, we're so burdened by these things that we kind of take them for granted, and AI cannot help with those things. We have to be able to, those are people factors that we have not addressed. Darryl Armistead?
Yeah, I think one of the problems with technology helping the like paperwork demands for doctors is that somebody has to pay for it. And our healthcare system in America is procedural based, so you get paid for the procedure. Now you've got an additional charge to add to that, and with any additional charge, you got to fight with insurance companies to pay for it. And health care is more unaffordable in the United States than any place else on earth, which you add to helping out the doctor's stress load, and it's even more unaffordable because you're adding costs. So um, I just see a problem with adding technology to help a doctor's workload.
Thank you for sharing. Any other comments? If not, that would be the last article of the day. Uh, uh, I had the opportunity, by the way, of participating in another group that was developing in Atlanta. So that it's interesting that we are seeing the development of more groups like ours across the United States, because there's another group of people of color who are working with others. So I think this model that we have established is something that is worthwhile, and hopefully it will be replicated across the United States.
Dr. Callender, is the one in Atlanta, is it up and running?
Yeah, I presented to it last Monday. Oh no, yeah, this Monday, right. Dr. Perez?
It warms my heart. Let me tell you, it warms my heart to hear you say that, Dr. Callender, because I know that that was something that your wife wanted. She wanted all of the groups like this to be united and to come together. And the spirit in my heart just dropped because I know that Fern is pleased that you're carrying on this work.